Hello, this is Dr. Abhijit Kulkarni, consultant electrophysiologist, Apollo Group of Hospitals. Did you all know our heart has an electrical system? Yes. Apart from the common known problems which are associated with the pumping of the heart, we have an electrical system of the heart, which is responsible for the coordinated contraction of the heart. So once there is a system, there can be problems, and that is where electrophysiology comes. Basically, it deals with the electrical problems of the heart. So there is a system which regulates the heartbeat, and normally we all know that the general heart beating is between 60 to 90 beats. Now, if there is a disorganized beating, or it is called as arrhythmias, wherein the heartbeat can be very fast or it can be very slow. So these are called as arrhythmias. So both of these problems can result in significant symptoms, deterioration in quality of life, also translates into reduced heart function over a period of time, and is manifested by the cardinal symptoms of palpitations, wherein the patient feels abnormally aware about one's own heartbeat. Second is dizziness. If the heartbeats go very slow or very fast, the degree of contraction of the heart, if the heart beats very fast, then the quantity of the beating is so high that the quality of the beating is compromised. So when that happens, there is no blood flow to the heart, to the brain and the other organs, and that is why they come with presentation of symptoms like giddiness, falls. You might all know that many elderly people keep on falling, and one of the common reasons for this is the arrhythmias, wherein especially the heart rates being very low. When the heart rates are very low, the blood supply to the brain during that period is so low that it is unable to maintain proper consciousness in an alert manner, in a standing manner. So that is why these people collapse. And then once the heart rate is regularized, then they just wake up and then start to walk. There's a need to understand, there's a need to understand that these problems do exist very commonly, and there should be an attempt to understand these problems to make a difference to these things. Now, I was talking about the low heart rates. There are the low heart rate problems are more common in the elder age group, but the high heart rate problems are very common in the younger age group. Many of our young individuals, especially between 30 to 40 or 30 to 50, can have problems of increased heartbeat, wherein their heart rate races to as high as 200. So it can range between 120 to 150 to 200. Now we all know that in certain situations where we are anxious or we are doing some activity or we are running, the heart rate races. But these are situations when we are not doing anything, but still the heart rate races extremely fast. And these are the problems of the electrical system, wherein there is a short circuitry involved, there are multiple paths involved in the heart, which result in such an arrhythmia. So sometimes when the patient comes back to the OPD for evaluation, he will not be having this problem. He would have experienced it some time back and it would have subsided, but by the time they come to the OPD, it's not available to be detected. That is why we use specialized testing called as Holters, wherein we extend the ECG for 24, 48 to 72 hours to monitor the heartbeat of the patient and to make sense of what is happening to them. Sometimes when these problems are even more elusive and not detected in that 72-hour window, then we do something called as an electrophysiological study, wherein small catheters which are electrically stimulatable are passed inside the heart. These are procedures which can be done under local anesthesia. They are extremely safe, much safer than an angiogram also, and the heart can be programmed manner stimulated, and these arrhythmias can be understood or provocated. And once the heart rate starts beating very fast, we can still confirm with the patient, is this the way that the patient felt when the patient had this arrhythmia? And then and there, these things can be ablated. So these are extremely quality of life improving therapies which are available. And the way to understand where the beat is coming from the heart, there is something called as a 3D mapping system which is available. It helps us understand in a three-dimensional manner in which part of the heart exactly this abnormal circuitry is there. There are some specialized catheters which are placed inside the heart, which are actually under 3D navigation, and it will help us localize the problem to one particular spot in the heart wherein we go and map the problem and then ablate the arrhythmia. So this is the scope of electrophysiology. Apart from that, the electrical system and mechanical system are properly coordinated inside the heart. If there is dysregulation of the electrical part of the heart, then the mechanical system also degenerates. In the sense that if the electrical system is not very properly coordinated, the pumping of the heart, which has to be the upper two chambers have to pump inside the lower two chambers, and the lower two chambers then sequentially pump the whole blood into the whole of the body. But when this sequence is dysregulated by way of arrhythmias or by disorganized contraction because of the electrical disorganization, then these things can be corrected to achieve proper contraction of the heart. This is called as resynchronization therapy. When there is desynchronization, we can correct that by doing resynchronization by placing the leads, the pacemaker leads, in appropriate chambers so that the organization of the electrical beating of the heart is properly done, so that we achieve a proper mechanical contraction and heart failure can be resolved. So it's a multi-system or multi-modality speciality wherein we correct the electrical part of the heart to achieve mechanical correction and improve pumping of the heart. So the scope of electrophysiology is apart from the electrical system of the heart, also is connected with the mechanical part of the heart by way of cardiac resynchronization therapy. Another important scope of electrophysiology is in the prevention of sudden cardiac death. We all know that patients who are having low ejection fractions or whose heart pumping is very low, they are susceptible to sudden episodes of sudden cardiac death, wherein the heart beats very fast and then it fails to contribute to any meaningful contraction at that heart rate. And if that heart rate is not solved at that instant, the patient collapses, and then if it is not understood why he has collapsed, the patient passes away. So the time window that is available to us is very, very low. So we actually try to understand who are the patients who are at high risk for such an activity, who are at high risk for sudden cardiac death, by doing certain non-invasive measures in most people, by screening their ECGs, by screening their echoes and doing their Holters, or understanding those patients who are presented with an episode of syncope by making these evaluations. If they fit into those criteria, then we place something called as an intracardiac defibrillator. So basically, intracardiac defibrillator will actually circumvent the time that is needed to make the diagnosis. It is an intelligent device which is placed in the chest, connected to the heart, and beat by beat analysis is made as to whether there is an abnormal rhythm that is originating from the heart. And if there is an abnormal rhythm, it will not only track that rhythm, it will take corrective steps to change that rhythm. And if it is not able to correct that rhythm, then it will shock the patient. So hence preventing this major syndrome and a purely fatal syndrome of sudden cardiac death. So that is how differences can be made to the patients with the implantation of ICDs or intracardiac defibrillator. Another significant advance of electrophysiology now, we are aware about the single chamber and dual chamber pacemakers. Nowadays, we have something called as the leadless pacemaker. So these leadless pacemakers can be put inside the heart without any connections or without having to connect it through create a pocket. They are just implanted through the venous route, put inside the right ventricle of the heart and allowed to pace. So this is a significant advancement, and it will serve very well for the elderly who are not able to undergo a procedure, who have venous problems, or who are too frail to undergo a pocket creation, or who are at high risk of infection because of the pocket. So these are the subsets wherein leadless pacemaker can be used, wherein a small pacemaker which is capable of doing the same thing as the larger pacemakers that we are all aware of can be put inside the heart, and the heart rhythm can be normalized. So this is the scope of electrophysiology in today's world, and there's a lot of advance. And because a lot of our MI patients are surviving and they have got heart failure, the scope of electrophysiology is even increasing, because the burden of the patients who are surviving, they do end up having certain arrhythmias and certain LV dysfunctions which can be corrected by the devices which are available by way of electrophysiology, and also these arrhythmias can be ablated by the 3D mapping system. Thank you so much.